Good afternoon. Welcome to this event, panel discussion organized by the Global Health Center of the Graduate Institute. We welcome the audience in the room. We know that there are many people online that are sort of hooking in right now. It's good that we have a mixed crowd. I see familiar faces in the room. I see some of my students. They hope to get extra credits for being here, but it's not the case. But good try nonetheless. I see some familiar faces at the diplomats. So it's good to have this mixed crowd, and we welcome also the interest on a topic that has directly something to do with these complex parallel negotiations going on in WHO on a new pandemic instrument. We don't dare to say treaty, we say instrument, and amending the international health regulation. So for those who don't know me, my name is Gianluca Burcio. I'm an adjunct professor of international law here at the Graduate Institute, academic advisor to the Global Health Center, and co-investigator together with Professor Suri Moon of the initiative on governing pandemics. So we entitled this panel discussion Averting a Collision Course Beyond the Pandemic Instrument and the IHR for two purposes. The first to give a sexy title and as a marketing pitch and see whether we attract more audience. But the second, because the purpose of this meeting, we hope, is to stimulate some fresh thinking, some fresh discussion that will not necessarily stop here. We hope to continue in other venues. We will be able to continue on things that are normally not raised in the Geneva crowd, or on some issues related to renegotiation that delegates don't have the time and the energy to deal with because you are so busy 2 to 7 days a week that probably sometimes you don't have the time to take a step back. So we would like to touch 3 points fundamentally. The first is to have a bit of a legal look at these funny parallel processes and how do these parallel negotiations talk to each other? How can we foresee and avoid conflicts either during the negotiation or also after the negotiation? Because when you have two instruments, you need to apply them and interpret them. The second is the politics. And that's something that people talk about it, but don't talk about it. And so how some of the positions of some key players have influenced the way the processes look like. And of course, the delegates in the room are more than welcome to react to what we will say, to present the positions of the government. I think it will be very interesting. And the third is thinking out of the box in terms of the outcome of these negotiations. In particular, complex topics, we have chosen two. One, health, which is a flavor of the decade, as you know, and pathogen and benefit sharing. Fundamentally complex, interdisciplinary, and I think it's delusional to think that a treaty or the IHR can solve everything. And there are many things going on in the ecosystem outside WHO. So how can a final package look like? So this is the rationale for the panel. And so the program is as follows. I will introduce the speakers one by one, and I will ask them a question for the initial presentation. They will have about 10 minutes. They will try to enforce if they only look to me from time to time. And depending on what they say and how much time we have, I may have maybe a follow-up question, or you may have questions for each other. And then we open the floor for questions and answers. For the people attending online, I think the chat has been deactivated, but you can ask questions using the Q&A function, and I will monitor the question and try to be fair in terms of distribution between the room and the attendees online. And at the end of the event, we have an apéro upstairs, so you're all warmly invited to join us and continue the conversation in front of a glass of wine. Okay, so without further ado, let's start. And our first speaker is Pedro Villarreal. Pedro is a senior research fellow at the German Institute for International and Security Affairs and at the Max Planck Institute for Comparative Public Law and International Law in Heidelberg. His research focuses on international comparative health law, intersection with international economic law. And we've been working together quite on a number of projects. So Pedro, you're the lawyer in the room, the generalist international law. And so what is striking about these two processes is the level of overlap. If you look at the two texts, there are many proposals that look the same or very similar. then pathogen and benefit sharing, access to medicine, technology transfer, financing, and so on. So how do you assess the impact of these overlaps for the outcome, for an effective system of pandemic prevention and response? And international law try to avoid conflicts and fragmentation. So what are possible solutions that you envisage? What could delegates keep in mind during the negotiations and after the negotiation in terms of trying to achieve complementarity and synergy and not a mess of conflicts and so on? Please.
Well, thank you, Gianluca, for the kind introduction and, of course, for the very complex questions. I hope I do not let down the expectations that you have raised so far. Because these are indeed tricky questions in terms of harmonizing and making sense of these overlaps that we are seeing. So again, I thank the organizers at the Graduate Institute for allowing me the privilege to speak to you today. And so in my presentation, and regarding your questions, Gianluca, I would start by saying that if we look at how these two processes began, so how they were launched or triggered, so to say, so we'll see that firstly, there was the idea of having a so-called pandemic treaty. I know that the terminology is now being avoided and to keep the possibilities open. But after ideas came from the European Union to launch such a treaty, and we had the process initiated at the special session of the World Health Assembly in 2021. And this has led us to the current state of affairs. We have several milestones there that we have witnessed. And at the same time, or well, a bit later than the official launch of these negotiations for, I do call it a pandemic treaty here in the slides, but keep in mind is, so the acronym that is preferred is CA+, referring to a convention, agreement, or other legal instrument. And this should be emphasized that this other legal instrument is still a possibility. But so a few 2 months after this process had already been launched formally by the World Health Assembly, a different negotiation process was launched, particularly by through a proposal made by the government of the United States to amend the international health regulations. This proposal was presented and circulated to member states in January 2022. And already here we see how the structure is different in the way in which each process began. So one was the outcome of a World Health Assembly resolution where states unanimously agreed to, by consensus, to launch a process. And the other one was as a reaction to a proposal made by a single member state. And both of these processes have as a goal to submit the actual proposals, the proposals that will be voted upon to the 77th World Health Assembly in 2024. So next year, time is running, and we're already at the negotiations phase. We already have initial texts, either a zero draft or a compilation of amendments proposed to the international health regulations, and also an IHR review committee report which scrutinized them and made technical recommendations. And we have here among the panelists Gianluca, who was also a member of this IHR review committee. And what we see, at least in the texts that are published so far, and please note that this is subject to further change as the year goes by. Well, firstly, I would somehow bring up the point that these two instruments have a very different procedure for entry into force, and this will as well determine both how many states will be states parties and the effectiveness of obligations within each. Because on the one hand, at the World Health Assembly, once these proposals are presented at the Assembly, if an instrument is proposed under Article 21 of the WHO Constitution, and many of you will be familiar with this procedure, there is no ratification procedure required for its entry into force. These are regulations, right? These instruments are denominated as regulations. And after a specific time period, as long as a country, a member state, state party does not opt out, these regulations will enter into force. Conversely, with regards to the CA+, with the pandemic instrument, once there's a resolution adopting this instrument, we still need the acceptance, the ratification of national bodies, usually before that instrument enters into force for that particular member state of the WHO. And there's the precedent of the Framework Convention on Tobacco Control, and this is the model that's being followed here with the pandemic instrument. But what this effectively means, and what the constellation that we can visualize because of this procedure for entry into force, is that at least at the beginning, and one might say even at the long term, the pandemic instrument will have fewer states parties than the regulations, because it is the case, and it has been historically the case, that those instruments requiring ratification often experience delays in that procedure or do not get ratified at all. Whereas with the regulations, historically there have been opt-outs, but the current regulations of 2005, the international health regulations, are applicable to all WHO member states and to other ones who decided to accede to them. And so what this means in terms of the obligations, I won't be able to deal exhaustively with the substance, right, of every overlap. But this will definitely have an impact on how obligations in each instrument, either in the amendments or the pandemic instrument, will be applied, will be implemented in the future. Because if we visualize, right, the scope of these obligations, well, first the scope of each instrument, they have some divergences that are worth discussing. So firstly, we have that both instruments will foresee obligations that are applicable at all times, right, regardless of whether there's an emergency or a pandemic. And we can refer to that as a non-emergency or an inter-pandemic period, as the pandemic zero draft refers to it. So both instruments envisage these obligations that are applicable for states parties at all times. And there are some obligations that currently do not overlap, and these we'll see whether that changes in time. And I can list a few, but in the interest of time, we have several, like building up minimum core capacities, though it might be argued that there is overlaps with collaboration and assistance. And on the other hand, we have safeguarding medical supply chains, that pandemic instrument, which currently is not foreseen by the international health regulations. But I guess the concern in the negotiations is what happens with those overlaps that apply firstly during these so-called non-emergency or inter-pandemic periods, so obligations that states at all times must fulfill. We see that in both instruments, either in the amendments or in the pandemic instrument, there is a commitment to provide financial assistance, to financially contribute. And we have data sharing obligations, including genetic sequencing data. And we have equitable sharing of medical countermeasures and technology, which is the subject of heated negotiations. So this, so far, regarding these periods, where let's call them ordinary periods. And in terms of the scope of each instrument, we have that, there's the category that the international health regulations foresee is that of a public health emergency of international concern, which in its current formulation, in its current provisions, does not create new obligations for states whenever it's declared. There are proposals, right, that might point towards creating such new obligations. And there is a possibility to create an intermediate level of alert. But if we look at this particular period, whenever we're facing a public health emergency of international concern, and if we compare it to the, let's say, equivalent emergency period in the pandemic instrument, we'll have a pandemic, right, which is a species of the genus that is a public health emergency of international concern, because while not all public health emergencies of international concern will be pandemics, it is to be assumed that all future pandemics will be at the same time and at a first instance a public health emergency of international concern. I can expand upon this reasoning. But here we see that whenever a pandemic is declared, at least in the current formulation of the zero draft, this will trigger a number of obligations for states parties, including regarding intellectual property rights, the payment of royalties, and applying the TRIPS flexibilities. But one question that emerges is, in light of what I just said, that we were likely to see fewer states parties at the beginning of the entry into force of this pandemic instrument, is what will happen in such a situation where a pandemic is declared and it turns out that obligations are applicable to some states but not others? What happens to those others that are not obliged to under the pandemic instrument? So we'll have a jigsaw puzzle of fragmented obligations where the future pandemic response might go different ways, as similar to what we saw during the COVID-19 pandemic. And this, of course, is far from being an ideal scenario. In light of this, and considering that this proposed pandemic instrument would have a more specific scope than the international health regulations with regards to these events, what solutions can we envisage? What can we discuss, or I would propose to discuss? So first, practical solutions on how to better synergize these two negotiating processes. So one would be, as we have seen in an informal manner, one would be to hold ad hoc meetings between both the intergovernmental negotiating body that has drafted the pandemic instrument and has now overseen the negotiations, and the working group of the international health regulations, which is the corresponding body tasked with streamlining amendments. And there could be an agreement on where to put which provisions and in which instrument would each provision be located. So this is one political solution, and it requires coordination. But of course, this still raises the question, do negotiations continue separately? So a second practical solution, more ambitious one, but therefore more challenging from a legal and political perspective, is to merge both negotiations into one. So why not negotiate everything together and then decide what goes where? Because first it's about knowing whether there is consensus at all. But this stumbles upon the obstacle that each body has a mandate. Each of these bodies, the IMB and the IHR working group, has a specific mandate to negotiate in their particular remit, and it will entail change in this mandate, and I'm aware that's quite a tall order. But let's assume that these practical solutions are still not reachable, right? Are not at hand. We can still think of some conceptual solutions. By conceptual, I mean how to draft and how to visualize how obligations will look like. So first, to consider what type of overlaps we're dealing with. Not all overlaps have the same nature. There are overlaps, and then there are overlaps. Because provisions with a softer wording will not be as problematic, right? The provisions that have commitments but do not have specific yardsticks for compliance. If there are overlaps, well, it's not much of a problem in theory. But another technique could be to, and this is well known in treaty law, that to state in one instrument that the obligations of the other take precedence in particular circumstances. And this has been attempted in the past. That could be a conceptual solution to draft, considering this form of obligation. And lastly, if it comes to that, future conflicts that were unforeseen at the point of negotiations emerge, well, we'll still have the lex specialis doctrine, which could help us determine which obligations would take precedence in the future. And in light of what I have argued, I would consider that the pandemic instrument has a more specialized factual basis or factual remit, and that would mean that its obligations during a pandemic would take precedence over those of the international health regulations in case of conflicts, right? But if there is no conflict, we don't need the lex specialis doctrine for that. I'm more than happy to continue discussing this because I know there are multiple complex legal issues, and I thank you for your attention in the meantime. Thank you very much.
Thank you, Pedro. So Nice, very loyally presentation. I really like it. I already have a follow-up question, but I'll pose it later. So, next speaker is Hélène de Putter. Hélène is assistant professor at Franche-Comté University in France, where she teaches international law, EU law, administrative law. Her area expertise include global health law, climate change law, and law of international organizations. And if I can add, she led a committee, which included also me, that drafted a white book on One Health for the International Law Association. So we consider an expert on this. So, Hélène, One Health is one of the flavor of the decades. Everybody sees the importance of addressing the risk of zoonotic spillover, the interaction between animal, human, and environmental concerns. But how do we operationalize this? How do we envisage it in the current process? And I have two questions. The first is, again, going back to these metaphysical differences between a regulation and a treaty. Is there a cogent reason why One Health should be regulated in one rather than the other? And also, having seen the text of the treaty, because I think the draft instrument is more developed. I think in the IHR is mentioned once or twice, but it's much more developed, fleshed out in the draft instrument. Do you think it hits the right spots? Or are there measures missing that you think would be important to have an effective package at the end?
Yeah. Thank you, Gianluca, and thanks to the Graduate Institute for its invitation to present my work and to engage in a dialogue with such a distinguished audience. So I will divide my presentation into two parts. I would like to come back on the question of allocation between the IHR and the pandemic instruments. So this will be more about methodology. And in the second part, I will touch upon the question of content. When we talk about One Health, what content could we have in the text? So, as you know, One Health is being discussed both for the IHR and for the pandemic instrument. So the question is, which instrument is better suited for One Health norms? And this could seem a minor question or a mere methodological question, a mere technical question, but actually it's more than that, because the WHO negotiations are unfolding in very troubled times for multilateralism. Last Tuesday, the UN Secretary General said, and I quote, that the multilateral system is under greater strain than at any time since the UN was created. So the success of the ongoing negotiations at the WHO cannot be taken for granted. So the challenge for states, for their representatives, for diplomats, is to keep health and health cooperation safe from the global disturbances that we are witnessing nowadays. And to me, a key element to safeguard health is to go back to the intention of the founding fathers, which are the drafters of the WHO Constitution. So as you know, the drafters of the WHO Constitution gave the WHO a normative capacity. The WHA can adopt conventions, regulations, and recommendations. And this triptych is not random. It has a rationale. And I don't want it to become an international class, but I think we should go back to the rationale of each of these instruments, especially the conventions and the regulations, since these are the instruments which are at stake when we're talking about the pandemic negotiations. So I want to highlight an important difference between the conventions and the regulations. Pedro Villarreal said that the convention, the CA plus, would be more specific, a more specific instrument, a more specific scope than the IHR. But at the same time, I see the IHR with a more specific nature and purpose. So Article 19 conventions were conceived as traditional treaties. You know, they are legal instruments that are the results of intensive negotiations and concessions, and the purpose of the negotiation is to try to find a balance between competing states' interests and ultimately to try to agree on transactional commitments that would be satisfactory for all parties. But if eventually the balance is not satisfactory, a state can always decide not to ratify the convention and not become a party to a convention. So this is Article 19. And alongside Article 19, we have Article 21 regulations. Article 21 regulations were not conceived as traditional treaties. They don't have the political dimension that treaties have. As you can see on the list in the screen, regulations are about procedures, nomenclatures, standards, procedures again, standards, and norms on advertising and labeling. So basically, regulations, the purpose of regulations is to make sure that states speak the same language in the health sector, and they are also here, the regulations are here to help states coordinating their action. So regulations are technical and procedural tools. They are designed for the sake of an efficient cooperation and coordination in the health sector. By their very purpose, regulations should be beneficial for all states and for health cooperation, regardless of political cleavages and specific national interests. So the prime vocation of regulations is to be universal. The more we have parties to the regulations, the more efficient and effective they will be. And since regulations are not political instruments, there is no reason why they should not be universal. So here is the rationale for the unusual procedure governing their entry into force, and Pedro presented this unusual procedure. But I would like to insist on the fact that this is unusual. This is very rare to have this in international law. Regulations are not subjected to the traditional ratification process. They enter into force automatically. This is really remarkable. And why is it like that? It's because health requires regulations to be universal, and because regulations are not political instruments, there is no reasons why they should not be universal. So think about another kind of regulations which is less famous than the IHR. It's the WHO nomenclature regulations. They were adopted in 1948, updated in 1967, and they were adopted on the basis of 21B. The purpose of the nomenclature regulation is to compile and publish statistics of mortality and morbidity in comparable form. So you see, they have a statistical purpose, and it is important that all states abide by these nomenclature regulations, and there is no reason why a state would reject the nomenclature regulations, because this text is beneficial for all. It's not politics, it's just coordination. So they entered into force automatically. And this is the same thing for the IHR. Actually, IHR were adopted under Article 21A, and their purpose is to have an orderly response to epidemics and pandemics, because in the past, before the 20th century, the national responses to epidemics were anarchic, uncoordinated, sometimes excessive and contradictory sometimes, and therefore they were costly. So you may ask at this point of my presentation, how does what she's saying impact the negotiations? Well, I think negotiators must keep in mind the original spirit of Article 21 and 22. They must safeguard the universality of the IHR. And to do that, it is crucial to keep the IHR safe from a political dimension and from political division. So before amending the IHR, states should make sure that the amendments reflect the spirit of Article 21 in general, do not exceed the scope of 21A, and they should make sure that the amendments rely on a broad consensus as to their relevance and to their necessity. If states ignore this and turn the IHR into a political and divisive instrument, it will make more harm than good, because some states will opt out from the revised version or formulate a lot of reservations, and it will be the beginning of the end of the IHR. Because instead of having one universal, readable, coherent, efficient IHR designed to ease and to facilitate coordination, we will have a complex web of differing obligations across states, and this would be at odds with the purpose of the regulations, which is to enable an orderly response to epidemics. Ultimately, politicizing the IHR would undermine the current effort to improve international health law. So now, if we come to the substance.
And you have 3 minutes.
Yeah, to the substance. So, talking with Gianluca, we decided to focus on 3 topics: surveillance, national risk reduction measures, and science policy interface mechanism. So I will start with surveillance. One Health experts underlined that we need to develop integrated One Health surveillance system. Integrated means that we make a surveillance of human diseases, but also of drivers, of zoonotic spillovers, and of AMR. And actually, the zero draft of the CA+ does contain a reference to One Health surveillance capacities. But actually, the IHR already contain provisions on surveillance, and I'm referring to Article 5 and Annex 1. So instead of having surveillance capacities and surveillance obligations, spread among the IHR and the pandemic instrument, it would be more coherent to amend the current IHR to update the list of surveillance capacities to adapt them to a One Health approach. It could be, states can feel that it's burdensome, but we can think of a progressive calendar for the implementation, and also the WHO is always here to support states when they apply the IHR. About national risk reduction measures, so this is fundamental. It's a priority that has been highlighted by several organizations during the consultation process by the INB. One Health experts finds that we do need to pay more attention to pandemic prevention at the source, and to tackle the drivers of the pandemic, including land use change, industrial production, deforestation, ecosystem loss, and so on. This is a substantive core of One Health. So to do that, states could commit to adopt One Health national plans and could commit to adopt national risk reduction measures. The aim is to prevent the pandemic at the source. But again, states might find this overwhelming. So to facilitate consensus, states could decide that the national plans, the national contributions should be defined progressively and reinforced with time in a similar fashion as the nationally determined contributions of the Paris Agreement on climate change. So if we go back to the question of allocation, I think the pandemic instrument is better suited for such measures because the IHR are event-based. The IHR suppose that something is happening that needs to be contained by the states. Whereas when we're talking about risk reduction, we are talking about background work. And this is more for the pandemic instrument, because here we are far from mere procedures. And lastly, about a science policy interface mechanism. That's an interesting proposal. I think we need such a mechanism to inform policymaking through commissioning the science, to provide scientific advice, to help identifying gaps, and also to highlight priorities, because One Health is so broad that it's difficult to know where to start. Such a mechanism goes beyond the mere IHR, clearly. So IHR is not a place. Is the pandemic instrument a better place for such a mechanism? I don't think so, because, you know, One Health suppose that we have a cross-sectoral approach. So if everything is negotiated at the WHO alone, it goes against the very purpose of One Health. Such a mechanism should be developed in association with the other organizations involved, like WOA and UNEP and FAO. So, and I will conclude. Sorry, Gianluca. This is my conclusion. The challenge is not only to amend the IHR or to think about the current process, the pandemic instrument. It's also to think beyond the IHR and the pandemic instrument. The future instrument and the IHR will be part of a broader ecosystem of norms and bodies. So we need to think about synergies and interaction among them. So this is just the beginning. Thank you.
Thank you very much, Hélène. And you know, your last point made me think about the IPCC, that after all is not created by the Framework Convention on Climate Change, has been established before, so in a way it's outside but feeding to a normative process. So very interesting point. Okay, next on my list is Elisa Morgera. Elisa is a professor of global environmental law at Strathclyde University Law School in Glasgow, and specializes in international biodiversity law and its interactions with equity and the protection of human rights. Elisa is also the director of the One Ocean Hub, very current topic with the finally UN Water Conference and so on, an interdisciplinary research collaboration between several research institutions as well as the UN agencies and other international partners. So, Elisa, we assigned the difficult task to talk about access and benefit sharing, or as we say in WHO, pathogen and benefit sharing. And so you're an environmental lawyer, and see, the access and benefit is something that has been tested in the environmental field, and in particular the questions of benefit. So with the insights from environmental law and the other fields you're familiar with, in particular also marine resources and so on, what lessons do they give to this negotiation? How do we conceptualize, frame, pathogen and benefit sharing? As you can imagine, is quite controversial in a way that takes into account the lessons from this other field. And in particular, if you have time, BB&J, now everybody talks about the BB&J. Is there any, of course, I mean, just been adopted, we don't have implementation practice, but many people see it as a step forward. Is it really, and does it have something to show, or positive for the current negotiation? Thank you.
Thank you so much, Gianluca and colleagues, for the opportunity to share indeed the many lessons learned, although some remain quite puzzling, from international environmental law related to fair and equitable benefit sharing as a principle, as an objective, and mechanisms that have been created across different sectors in international environmental law. So we'll start with some broad considerations that I think are relevant for WHO negotiators, at the very least not to repeat some of the pitfalls in which their predecessors in other areas of international law have fallen into, let's say, but also some open questions that are still being debated in other international fora, and see how they speak, in fact, to One Health, and to the many references in the draft preamble of the pandemic instrument to human rights. So we have several international multilateral benefit sharing mechanisms. They're all in very different sectors, from deep seabed mining to plant genetic resources for food and agriculture. I'm sure everybody in the room knows the PIP framework. And just very recently, we adopted a new international instrument on marine biodiversity of areas beyond national jurisdiction, which also heralds a new multilateral benefit sharing mechanism. They're very different, developed at different points in times, but I think there are certain common challenges that have emerged. And I think maybe something helpful to think about is that even if we speak about benefit sharing as this quite alluring and kind of comprehensive concept, it is important to breaking it down into accruing benefits and thinking about whose benefits are we looking into, who is going to be benefiting from them, and then the distribution of benefits. Because in fact, this requires different international obligations and different mandates for international institutions. And at both sides of this benefit sharing equation, we have encountered significant challenges. So what's important to keep in mind is that even if you have multiple experiences in developing and operating multilateral benefit sharing mechanisms, none of them is perfect, none of them is fully operational, and under each and every one of them we're discussing iteratively improving, if not rethinking, the original idea around a benefit sharing mechanism. And so one of the key issues that has, I think, come up in terms of accruing benefits is that of ensuring the financial viability of those instruments, even if the assumption is that benefit sharing will generate new financial benefits that can feed into a benefit sharing process. The reality is that things are much more complicated, and particularly in relation to research and innovation processes, we never really know when those monetary benefits will arise, let alone then accrue to a multilateral system. And we have come up with solutions which were, I think, particularly significant and helpful in the context of the PIP framework, but also, for instance, in the context of the BBNJ agreement, we have now annual contributions, and this really responds to the lessons learned in the other processes that we need donations or some source of financial contribution beyond what may be seen as benefit sharing. On the distribution of benefits, I think there are also important lessons learned, and that is that equity is not something that just comes up out of normal relations among countries and researchers at very different power situations. It's something that requires attention, monitoring, continuous learning, and in fact maybe a more proactive approach by international institutions in brokering, matchmaking, and understanding where things work and don't work. So in a way, what I think is really important is to think carefully about the assumptions about fairness and equity in benefit sharing, and really think about the underlying rationales, what we're trying to achieve. And while we may think the beneficiary is a term that's kind of somebody at the receiving end, once we look at a teleological interpretation of benefit sharing, which has also been used in international human rights law as well as across other areas of international law, we're really looking at an active participation of beneficiaries. We're really looking at their agency. And that's, in a way, a pragmatic realization. Not any benefit is really helpful to beneficiaries. We need to understand what they need and, in fact, co-identify benefits and sharing modalities that make sense for beneficiaries, even if in many ways the obligations underpinning the benefit sharing are very much in the hands of states with the resources to provide certain benefits. In addition, we can never quite pin down a perfect system of benefit sharing. This is very much an iterative process, and this is because equity also changes. We may start on a certain basis in a certain relationships, and as we go along, we'll realize that other aspects of equity arise. So the learning is ongoing, and we can't quite tell just from one side of a relationship what is fair or equitable. So it's an iterative dialogue as opposed to a top-down or one-off exercise. And that, in a way, is really showing that for how much often the prevailing narrative and maybe agenda in the negotiation is one of a logic of exchange. Well, we'll get access to pathogens, we'll get access to genetic resources, and there'll be benefits in terms of global health, in terms of global food security. That's not quite helpful. And in fact, it kind of moves away the attention from what's really needed to create a genuine partnerships among states and actors that are at different power potential. And this is that point of, I think, thinking about what we need for enhanced international cooperation. And this is the real underlying rationale for benefit sharing. And finally, maybe the other blind spot in taking that logic of exchange approach is that we're thinking about immediate benefits. But the reality is that benefit sharing are often enshrined in international instruments that see a flow of global benefits as well as maybe more direct benefits for states that are more immediately contributing to a certain international objective. And it is important to create a system where we support as much the sharing and flow of global benefits and international cooperation to their end, as well as those specific benefits for specific beneficiaries. So what I think has then come out after decades of studying fair and equitable benefit sharing mechanisms in international environmental law is that fundamentally we're looking at enhanced international cooperation for research. We're really looking at the research capacities in different states to be able to realize global objectives. And that fairness and equity boils down to what can we do in international law, what are the state obligations, what are the international mechanisms that we can devise to support fair research partnerships, knowing that global north and global south countries and researchers are at very different stages in their capacities to contribute to global objectives. And so in that sense, well, we have those important references to human rights in the draft preamble of the pandemic instrument, and I think this is a crucial lens under the UN Charter for any new international law development that has to do with health and really human survival and flourishing. And I would just want to offer as a normative reflection the clarification of the content of the human right to science as an important lens to think in a systematic way around the role of international law in addressing those imbalances in capacities and those constraints in international cooperation between the global north and the global south, and the impacts that they have on the human rights of different individuals and groups. And what this helps to do is really to zoom in into key issues that can be considered in devising benefit sharing approaches, obligations, and mechanisms. And that's to do with realizing the effectiveness of any new international instrument will really bear on addressing the power imbalances that explain why certain countries are less able to realize certain international objectives. And then thinking about the aspect of beneficiaries' agency, not just looking at capacity building or technology transfer as that one-way global north to global south way street, because that is really not what has been helpful. I mean, unless we find ways for capacities and technologies to really make sense in the context of global south countries, all those efforts really have limited effect. And we have seen this time and again across the environmental sector and I think also in the health sector. So we really need to move into a multilateral framework where we understand and we are able to have a dialogue between global north and south states and key actors in understanding what is needed and learn from each other in terms of capacities and ideally co-develop technology as opposed to just expect that technology can be developed in the global north that makes sense and responds to the needs in the global south if we don't have that sustained dialogue about what the needs are and the capacities are. And that requires also understanding what goes wrong, what is going wrong in current international cooperation, because we have a lot of that from more informal bilateral scientific cooperation in terms of information exchange. And one good example is thinking about the role of global databases. We have a lot of information sharing. We have a lot of investment for global north countries in bringing together evidence, samples, and yet we assume that it's a global benefit. But in fact, those databases are not equally usable in the global south as they are in the global north. And the simple reason is that they're devised by global north operators that are familiar with global north conditions and uses. So trying to, I think, devise benefit sharing is about how we create a collective system for dialogue on real needs, where we listen to what global south countries and different stakeholders have to say about what they need, and we co-identify those benefits. And think where those efforts among states maybe fall short, and then international institutions can help fill in gaps, identifying where things fall through the cracks, and provide support for that more equitable distribution also across regions and areas. And I think that's where the notion of One Health and the importance of human rights, including also the human right to a healthy environment, really speaks to rethinking the role of international institutions with their mandate and expertise, and the need for, again, a deeper form of collaboration across sectoral international institutions in supporting that deeper form of international collaboration.
Elisa, sorry, 3 minutes.
Perfect. So I'll just move on then to more specific suggestions, just to give a sense of how do we bring those broader considerations into being in the negotiations. My suggestions are not necessarily written in stone. I'm really curious to hear what you think. But I just want to give you an example of how this thinking may play out in the more detailed negotiations that are ongoing. So if we look at the draft, the February draft of the pandemic instrument, where do we see that idea, the reference to the importance of global benefits, that sense of really taking as holistic as we can approach to the biodiversity human health nexus, and the underlying importance of enhancing capabilities and co-production of knowledge for prevention of pandemics, as well as preparedness and response. And one example, I think it's really important to distinguish between state obligations, what they need to put in place as preconditions for fair and equitable benefit sharing, and what they really commit in terms of support. And separating that from what may be the obligation that we may create through a standardized contractual approach for public or private researchers who will use the genetic resources that will be shared. And I think in this case, again, we can look at, for instance, trying to move away from that automatic assumption of the model of capacity and technology flowing from the global north to the global south in a helpful way, looking at where we can have more dialogue around what is needed, and thinking about also the real, I think, crux of the matter here is states can use their role as funders of publicly funded research to really create obligations for those entities that receive public funding to contribute to this. That's their key, I think, power and the key element that hasn't maybe used to the maximum to support this kind of international collaboration. And I think that we have some examples in the context now of the draft, but there is a certain sense of maybe lack of clarity about how far we're going, with those being obligations or not, and a more holistic sense of what are exactly states going to provide to make this work. On the side of public or private bodies who may seek access to the genetic resources, it's important to think about not just the sharing of then countermeasures, which is essential, but also thinking about their role in involving colleagues in the global south in building their own capacities for research and for development. And while you might think that this is something that happens normally in scientific research cooperation, that is not true. There's plenty of research showing how the equity and fairness in research partnerships is not something that just happens, again, organically. In fact, there's a lot of tensions and power imbalances there. And having specific benefits that may be standardized as contractual clauses in that connection may be an important element in moving towards creating effectively that capacities, building those capacities where they're not there yet.
I'm sorry, but we're injury time at this point.
Okay. So maybe the last point I'll make in a half a minute is thinking about the role of international institutions, the body we may create as part of the pandemic instrument and perhaps also the regulations, and finding a place there first for that iterative dialogue among beneficiaries, and that goes not just in terms of interstate dialogue, but I think different actors who are key for that research collaboration, from database managers to scientists to innovators, and really have them in a room to explain what the issues are that don't allow them to do more in terms of preparedness and response. And how we create a system where that learning is then built into the treaty life, into the review, into the adjustments that may be needed for fair and equitable benefit sharing systems to really live up to expectations. And that's part of a learning approach which we might see and which WHO may be able to create together with other UN organizations, and very much thinking about specific provisions on that learning with other UN organizations, exactly because we need the regime interaction to learn what's happening, say, in the context of marine biodiversity or plant genetic resources, as this is all linked in terms of One Health. So I'll stop there. Thank you.
Thank you. Being a moderator is a tough job because I need to keep a sense of time, but it's so interesting what you're saying that it's always a pity to stop you through. So apologies for stopping you. I'm sure there will be many questions. And so last but not least, Professor Daniel Warner, old friend, is a political scientist and a former deputy to the director here at the Graduate Institute. He's a frequent media commentator and a regular analyst on Inside Geneva, a podcast of the Swiss broadcasting system. He has served as an advisor to UNHCR. It's enough, okay. So he doesn't want to be praised. But let me ask you questions at least. And my question is the following. So Danny is a very astute and active observer of US politics. So I thought you would ask him something about the position of the United States, because it's been a major player from the beginning of this process. It has, in a way, jump-started the amendments to the IHR, so moved the total interest on the treaty back to rebalancing on the IHR. So quite an important role. So what is your take, Danny, on what is the factors, also the domestic factor, shaping the US policy position here, and how is that influencing the negotiation as you see them unfolding right now?
Thank you, Gianluca. I note that I am the only non-lawyer speaking. I also note that I'm the only one speaking about a country of the speakers, and I also note I'm the only one not using PowerPoint. Helen said that we should try to keep global politics out of global health. I'll talk about American politics because you can't keep American politics out of these discussions. In his first foreign policy address as the new president, Joe Biden spoke to American diplomats at the U.S. State Department. He said, and I quote, "America is back," he said it twice. America is back. Diplomacy is back at the center of our foreign policy. He said we must meet the new moment, accelerating global challenges, blah, 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 will only be solved by nations working together and in common. We can't do it alone. What did President Biden mean in terms of multilateral diplomacy? Specifically, what did he mean in terms of global health security? Now, there is no question that global health security is important for the United States. According to the global health policy, President Biden's initial fiscal year 2022 budget requested nearly $1 billion for global health security. Now, there is no question, as I said, that it is important for national security of the United States, national health of the United States, as well as for American businesses. I make no hierarchy of the three, but I do note that the U.S. healthcare industry is the biggest in the world. It has over 900,000 businesses, 20 million employees, and $4.1 trillion in spending in 2020. Again, I make no hierarchy between the three. U.S., specifically the point of the panel now, is if the United States is back in diplomacy, the importance of global health security is evident United States national sovereignty is relevant to both the INB, I'll call it, and IHR, and how so? Now, I'm going to read a joint statement by the Department of State and the Department of Health and Human Services about the pandemic accord that was put forward on March the 8th. And it said, while the United States is deeply committed to a process that should result in shared commitments and shared responsibilities among nations, we are also aware of concerns by some that these negotiations could result in diminished U.S. sovereignty. Any accord resulting from these negotiations will not compromise the ability of American citizens to make their own health care decision. Now, social media in the United States and conspiracy theorists, as well as certain senators and critics, have maintained that any international obligation, and specifically obligations concerning health security, will be a threat to U.S. sovereignty. And there is a long history that some of you may know in the United States of airplanes landing and taking over, and some precursor to some world government taking over from the United States. We also know that in the history of law, the United States has always maintained that its national laws have hierarchy over international law. And in many situations, it makes reservations when it signs for obligations, saying that this must be in line with what the American Constitution or law says. Now, in an attempt to assuage fears about the loss of sovereignty, the Director General of the WHO has made several statements and tweeted, "No country will cede any sovereignty to WHO. Countries will decide what the pandemic accord says, and countries will implement the accord in line with their own national laws." Now, in terms of the relationship between the two processes and the notion of sovereignty, the difference between the forms of the conclusion of the processes is important for the United States position, since any treaty, as has been said, must be ratified by the United States Senate, and especially in today's Senate, it would be difficult to get any multilateral treaty passed. As opposed to a treaty, changes in the IHR don't need Senate approval, and they are covered within the WHO Constitution. The United States has proposed more than 13 amendments of the 300 to the IHR, and some of these amendments would give more power to the WHO director. The question is why? Why is the United States willing to go forward on these? And it seems that other countries also have gone forward with proposals for far-reaching access for vaccines, technology transfer, intellectual property, and other issues, simply because they are skeptical that any form of a treaty will not pass the United States Senate. So that, to me, would mean that there is more of a priority within the American position, within the IHR, as opposed to some kind of treaty. However, it also should be noted that the United States has appointed a very, very high-level ambassador to these negotiations, Ambassador Pamela Hamamoto, and so there is no question that the United States is engaged in the INB. The question is, what does that engagement mean in terms of some final conclusion? Now, in conclusion, I have a Swiss passport. You learn certain things in 50 years. Huh? In conclusion, President Biden's statement that America is back in diplomacy was an important change in American presidential policy statements. Presidential policy statements. But the priority of U.S. sovereignty in terms of the two processes within the WHO does not change with administrations. Domestic politics, now including social media, can never be separated from American foreign policy. We should never forget, especially here in Geneva, that the United States Senate refused to ratify the Treaty of Versailles, establishing the League of Nations, inspired by its own president. Thus, the INB and IHR negotiations must walk a very difficult line between establishing international norms applicable to all countries and the United States' concerns about its national sovereignty and its perception of its national sovereignty. Thank you.
Thank you very much, Danny. I'm also Swiss, so I appreciate this keeping the. So if, obviously, I don't know if Cassie Peters or other colleagues from the US mission are in the room, and obviously feel free to respond. This doesn't have to be a one-directional presentation. So it's, okay, we are more or less in time. And before opening the floor, and I see for the moment we don't have questions from the audience online, so if you do, please put them in the Q&A and I will monitor the flow of questions. I see Priti Patnaik, but before I give you the floor, I just a quick comment, because I found, to Hélène, because I found very interesting what you said about the regulation being something non-political. Now, that may have been the intention of the drafters of the Constitution, and you're right. It was to overcome the patchwork of old treaties that were very ineffective, to have a very centralized authority that would somehow coordinate or create uniformity universally. But health has become immensely political, intrinsically political. So how is it possible to say that in 2023, regulation are still non-political as conceived in 1946 and must be protected from politics? Well, what does it mean in practice? Because, again, this is in a way defied by the breadth of amendment to the IHR. And I remember distinctly statements, as I was a member of the review committee, as you recalled, we had briefings with permanent missions, and some permanent missions said status quo is not an option. So the IHR have to incorporate equity, incorporate a number of issues that are intrinsically political. How do you square this contradiction?
Thank you, Gianluca. So as you said, the limits of the regulations have already been pushed very far in 2005 when we adopted the revised version. By miracle, it worked in 2005. The IHR are universal today. We have some reservations, but they are very limited reservations. But the context in 2023 is not the same as in 2005, and I'm afraid that it won't work in 2023 if we push again the limit so far, because we are living shaking, events, shaking days, the multilateralism is threatened. So I think a good compass is to make a step backwards, in a way, and to come back to this initial spirit. I think it can, ease the negotiations and facilitate consensus. That's my intuition.
Thank you, very interesting. Okay. Let's definitely open the floor. I have a Priti Patnaik over there, and then Anna. Yeah.
Hi, I'm Priti Patnaik. I publish Geneva Health Files. We have been reporting on both tracks of these negotiations. My question actually follows very well from Gianluca's question. So our reading is that countries appear to be divided on, whether to expand scope of the IHR or focus on the way it is now. And clearly, developing countries want to use this opportunity to bring in tough obligations on IP and PABs and so on into the IHR, given the uncertainty as to how many countries will eventually ratify a pandemic accord. So my question for the panelists, I think some of you have made your views known, but what is really legally feasible? How do you interpret existing, the way IHR has been articulated now and scope of the WHO Constitution? Does it actually allow member states to push the limits of the IHR and to take advantage of this historic negotiation, as it were? Thanks a lot.
Thank you, Priti. Would you like to collect a few questions? And Yeah. Okay. Then we have Anna Balcazar in the middle.
Thank you. Actually, my question is also linked to the previous one, and this is one triggered by one thing that Pedro mentioned. Actually, I also asking about the scope of WHO mandate, but then in one of your slides, you present the IP rights touching upon. So my question is, how to deal with the mandate of WHO, WIPO, and WTO? Of course, we have the quadripartite example, but this is different, other organizations. So my question is, can you think about this tripartite alliance similar to the one of One Health with these other organizations? Or what to do? Because the WHO mandate is different from that one from WTO and WIPO. Of course, also the composition, the institutions' composition is different. The role of the DGs of different organizations are different, so it's really complex. Thank you.
Thank you. So really 2 questions on limits of scope, in a way, and mandate. I have Matangi, Monsieur Kazachkin, and then Andrews. Yeah, I try to keep... and then we have also a question online.
Thank you very much. So I have 2 questions for the panel. One is on when we talk specifically about pathogen access and benefit sharing. I think I refer to your presentation, Professor Morguera, but I barely heard access as an issue, and we do know that there is a very, very heated debate on linking pathogen access to benefit sharing. Now, benefit sharing is a debate in itself entirely, but the transactionality involved in pathogen access and benefit sharing is something that we see is being carried forward into the zero draft as it stands right now. How do you think we can address this debate, the sort of elephant in the room on linking the two? That's my first question. And my second question is directed to Professor Warner. Thank you for your insights on the US position, but I was wondering whether there has been any consideration on looking at the pandemic instrument as an agreement similar to what was done for the Paris Agreement, because we do know that I think back then President Obama was also looking for a way to circumvent the Senate approval, which is also something that you're indicating right now. So has this been considered? Because we can still retain binding provisions while also circumventing tricky domestic requirements in the United States. And we all know we want the United States on board for the pandemic instrument. Thank you.
Thank you. Maybe circumventing is not the right term, but managing. Okay, would you like to start responding? Then I have Mrs. Kazachkin, Danny, and a question online. So maybe the first one, the feasibility of Article 21, the scope of Article 21. Maybe, Pedro, that's something you can address. Because in a way, there are 2 schools of thought. Some people say Article 21 talks about prevention. Prevention is prevention. And so you keep it within those confines. But others say, well, prevention is such a broad term in 2023 that almost anything fits, at least from a constitutional perspective. How do you... Yeah.
So, thanks, actually, that brings up quite well what the direction where I was headed, because I understand as well Hélène's point that we need to be careful, and there's always the fear of overreach by, in this case, by an organization, and this always brings up sensitivities, sovereignty issues. At the same time, if we speak on strictly legal terms, right, and interpretive terms, and this indeed goes to Priti Patnaik's question, I would see no legal impediment if there were such a political will to interpret Article 21 in a broader manner. That would, of course, require states accepting that, much like there is a discussion in constitutional law that the Constitution is a living instrument and it needs to adjust to changing times. And this is a big discussion where, well, is it a living instrument, or should we understand it the way in which the drafters understood it, and that's where it stops. it's a major political discussion. But at a personal level, if I may disclose my own personal views, if we speak, even if we take this strict interpretation of procedures designed to prevent the international spread of disease, which is already, international spread of disease is broadly understood, we can think of why equity would be a conducive element towards achieving that goal. Because if we look at medical countermeasures particularly, it is my belief that many of them will continue to evolve, many of them will continue to be more effective thanks to medical research and development. And if we see that these medical countermeasures may eventually be useful in preventing the spread of disease altogether, right? Not just morbidity and mortality, not just reducing the severity of an illness, but preventing spread altogether, wouldn't that justify then this broader interpretation of the Constitution and saying we need equity, we need to make sure that these medical countermeasures are available, because otherwise, we do not prevent. And again, the cliche, I know, but nobody is safe until everybody is safe does apply here. Okay. That's my view at least, but I know there are counter-arguments to that. Thank you.
Thank you. Hélène, what about this mandate issue that I think Anna raised? Because we're talking about IP, talking about things that are not squarely within the mandate of WHO. So,
So WHO member states can do whatever they want.
Okay. It's good news for you, I guess. We have the WHO constitution, but the ultimate interpreters of these texts are the member states. And as Pedro said, it's a living instrument, so everything is possible. So we can imagine that the IHR contains provisions on IP. Some states might call it a victory. But what we should take into consideration at the same time is the context of the current negotiations. And the context is not positive. We are not in a good context to negotiate new agreements. At the end, if there is no universality of the text because multilateralism is in crisis now, it will be a big failure. So I think states should attempt to safeguard this bubble of cooperation, this bubble which is the IHR, which currently is universal. That's a main message that I want to share with you today. Okay, no, very clear. Elisa, what about this access? You forgot about access. So, yeah.
Well, I did not forget about it, but I should have explained maybe more my position. And it's true that if you have noticed that I've been speaking about fair and equitable benefit sharing as a principle and objective and the mechanisms. I didn't speak about ABS mechanisms, even if that's the more common term in literature and in the negotiations. And the reason is that I think, first of all, we can have benefit sharing without access. And I find the benefit sharing as a principle, as an approach to equity, is quite helpful in going into exploring like deeper forms of cooperation. And unfortunately, yes, we need access, and there's an agenda. There's always an agenda about seeking and obtaining access in any benefit sharing negotiations. But we're seeing more and more how the two are being decoupled in the different regimes. And I think maybe, again, looking at the assumptions behind these words, I think that access, first of all, brings that logic of exchange, which is not helpful, eventually to really think about deeper forms of cooperation. And there's also an assumption about leaving unchanged the current conditions of power asymmetries. And that is the major barrier to having helpful and genuine collaboration in international law on those critical issues. So we need to understand how we can secure access, but I think it's really important to look at kind of agendas and look at benefit sharing as a separate concept, both in terms of the rationale for it and how it may work in practice.
So try to avoid these transactional linkages in a way, yeah. Danny, what about the Senate, this behemoth that seems to control everything?
The very good question. There is an election in 2024, so Biden and the Democrats are going to have to decide whether it's better to do something which they think they want to do but they'll be called globalists. On the other hand, if they can get some kind of accord where they can say, look what we're doing to China, it may be helpful in the election. But one should never forget it's all about domestic politics. Sorry.
Well, I think everything is. Okay, we have a question from Michelle Kazachkin, Danny Andrews, and then we have Carmen, and then we have 2 or 3 questions online, and then I think more or less we are at the end.
Thank you, Gianluca. I just wanted to ask a question about the implications of the limitation of a treaty or of an accord, since it only applies to the parties that will adopt it and ratify it, for governance / coordination / financing of pandemic preparedness and response. Are we moving towards having, let's say, a conference of the parties here in Geneva, and then something that will be discussed in another forum in New York, maybe during the General Assembly in September, which would be a supra body of or level of coordination and governance of financing.
And that, if I can, it ties with a question that I got online. Might as well put it there so you can address it. Sorry. About the proliferation of initiatives that are going on in WHO, in the UN, also the Director General, the number of initiatives. So in a way, how do you see this? Isn't there a risk of too many processes at the same time? Danny Andrews, please.
Thank you. Thanks very much to Graduate Institute and to the panel. I'm Danny Andrews from the UK mission. Really interesting and very diverse debate, so much appreciated. My question's for Hélène de Pruter. In your very interesting presentation, you touched on the science policy interface proposal, which is something that we're very interested in. And I thought I couldn't let you get away with saying not in WHO without saying where you think it might fit better. I mean, from our point of view, I think the science policy interface which is specifically around pandemics would be a very useful, and pandemic science would be a very useful addition. So I guess there's a question of, if not WHO, where could such a science policy interface sit better? Thanks.
Thank you. And Carmen Dolé on the side. Over there.
Hi, my name is Carmen Dola, and I don't know, I'm from the HR Secretariat in WHO. I don't know if you received Steve Solomon question online.
No.
But he asked me to ask a question, so I'm asking the question on his behalf because he wasn't able to put it online.
Thank you.
Steve is the legal counsel in WHO. So the question goes, treaty opponents on social media have a common theme, a narrative, that the pandemic treaty will take away country sovereignty and turn WHO into some sort of supranational organization. Obviously, this is not the case because, as the WHO Director General has said, countries are, and only countries, and many of you have mentioned already, only countries will decide what the treaty says and what will go there and in the IHR. And countries do not and will not tie their own hands on these issues. So the question is, what is driving this narrative, in your opinion? Thank you.
What drives these conspiracy theories? Yeah.
Basically.
That's an interesting question. Okay, I have a few questions online, and that I think fit with the general pattern of the questions here. One is about governance, and I think it's a very valid question. Come from Niklas Kramer. It's basically proliferation of governance. A treaty, if it is a treaty, we'll have a conference of the parties, how to align possible new governance on the IHR with the new ones for the instrument. So if they're two totally separate things, you either you have a proliferation of governance or you need to find some elements of coordination and bridging over. And the other one, I guess, it's maybe for final reflection. Would anyone on the panel like to comment on any lessons learned by WHO on what aspects of the COVID pandemic response they have learned, lockdowns, vaccines, and what they would do differently with the benefit of hindsight? There could be a separate panel discussion, but anyway, maybe you have some views on that. Is there any other question in the room? Okay. Otherwise, why don't we start with this conspiracy theory? I find it very interesting. Maybe Danny, you seem well placed to, because in a way, either you have the so-called tinfoil people, lunatics that believe anything, but it's too simplistic. Does anybody gain from weakening WHO, from weakening multilateral governance, and so on? I think it's a serious question.
No, I mean, it's a very serious question, and I don't know. I mean, I can guess on the origins. I don't know how to deal with it to stop it. What I do know is that Trump's victory on America First, 75 million people voted for him the last election. So there is something very profound in the United States about the notion of the city on the hill and being an exceptional country that does not enter into those kinds of alliances with multilateralism. Now, following from that are all of these corollaries dealing with airplanes and someone taking over the world. It's gotten to the point where it's not just fringe. And I don't know how to deal with it, but obviously one of the things that Biden can't do, I mean, Blinken, you'll never hear Blinken speak French, although he speaks fluently without my accent. He went to high school in Paris. The worst you can say about Biden or Blinken is that they're globalist in terms of getting election. So I don't know where the origin of the conspiracy, but the notion of America First has been there for a long time.
But if you look beyond the US, because it's not just the US that is conspiracy theories and so on. There are other governments that, so if you can generalize, who stands to gain from this?
Well, I mean, we can talk about populism. I mean, we can say in Switzerland how long it took before they joined the United Nations and how exceptional it was to be members of the Security Council. I mean, all countries have a certain notion of their special, the special of the country and the notion of the importance of their sovereignty. Obviously, for smaller countries, it's more important to be members of certain multilateral organizations. But the notion of conspiracy is part of populism, it seems to me.
Hélène, you had a question about the science-policy interface. It doesn't sit well in WHO. Where should it sit? And why?
Yeah, thank you, Gianluca. It's true that if we are talking about a One Health science policy interface mechanism, the place is not the WHO, because the very purpose of One Health is to have cooperation among sectors. So there is already a lot going on between the quadripartite, and they established HOLEP, the One Health high-level panel of experts. So I think we could think of a cooperative arrangement between the four organizations to think about the future of HOLEP. Actually, HOLEP itself is thinking about becoming such a mechanism. So this could be decided in a cooperative agreement among the four organizations. It could also come from an initiative by the UNGA, the United Nations General Assembly, but I think the quadripartite is a good place to have such a mechanism. And maybe ultimately it could welcome WTO, because so far the One Health mindset has not reached WTO. Ultimately, WTO could be included in such an initiative.
Thank you. Then obviously, institutionally, it will have to sit somewhere. I mean, the IPCC is sitting in the WMO, but it's not controlled by, not part of the governance. OLEP is sitting, hosted at least in WHO. So there has to be an institutional basis, which is different, I think, from the independence or less of this mechanism. Pedro, maybe you want to say something, and I think we are approaching really the end, on the governance issue. So you have a putative treaty with the Conference of the Parties, with the 80 countries, you have the IHR with the WHA. So how do the two coordinate, or the two separate worlds moving in parallel and so on?
Yes, thanks. That's a challenging question that came from several participants. Just to point out, I didn't forget about the question on IP rights, on intellectual property rights, but I'll can leave that for a bilateral discussion, a question posed by Ana Baltasar. But with regards to governance, what we see, at least at the moment, is there's the open question. So let's say we do manage to have these two instruments, and how, for example, will we deal with future compliance of, with each instrument? And you have different governance, proposed governance bodies for that to oversee compliance. Or how will questions of the interpretation, like the Conference of the Parties and the pandemic instrument, which follows, I take it, a very similar model that the Framework Convention on Tobacco Control, which has regular meetings of Conference of the Parties. And it should be pointed out that several of these governance mechanisms, well, the Compliance Committee is yet to be further defined under, for example, the international health regulations, but they're composed by member state representatives who are usually members of ministries. So I guess the big challenge will be not to overload personnel from these ministries more than they already are. I mean, they already have very big portfolios, and for countries with fewer, lower resources on this front, there's a big question, well, will they be able to really, will they have, let's put it that way, the broadband to really cover all of these governance issues, because there will need to be a constant engagement if, for example, compliance issues require permanent oversight. So this will require permanent or periodic meetings, who will be able to attend and so on. And if it is, ultimately, some of these committees are composed of independent or self-standing officials, so who is going to finance the work of these committees? But so far, it's mostly member state representatives, the ones that will be carrying this burden. It is indeed, I would argue, in favor of being careful with not overburdening an already overburdened public administration in each country. So that's my immediate reaction.
That's a good point. Elisa, final word.
Thank you so much. Yeah, just a couple of thoughts on these two questions, like maybe is there some uneasiness about the role of WHO that's not being appeased in the current draft, both in relation to other international bodies and also in relation to national sovereignty. And I think my feeling looking at the current draft is that there are two areas that are not clear enough that could respond to potential concerns in this area. One is that, yes, WHO could be the home for this agreement, but there needs to be much clearer provisions in the instrument about regime interaction. How will other international fora where we have relevant expertise be involved on matters of mandate, of cooperation, of, I think, fundamentally expertise, because the One Health approach means that we have to bring across expertise that at the moment is not brought together. And the new BBNJ agreement has some really interesting provisions all across about how they are going to address. That was a very tricky issue from the start of those negotiations. The second aspect is what will be the role and the value added of WHO vis-a-vis the role and obligations of states. And I think that doesn't come sufficiently clearly across the draft instrument. And I think particularly in terms of the privileged position of WHO as a multilateral instrument to look at areas of learning, to look at gaps in what states can try and do unilaterally and bilaterally. And I think really emphasizing the aspect of like learning across scales, matchmaking, contributing to that, understanding what are the reasons for maybe not sufficient progress on equity, which then I think translates into more effectiveness of individual states' efforts could be the key. And again, more specific provisions could be made there. And again, the BBNJ agreement has some interesting examples that could be looked into.
Thank you. So homework for everybody. Let's look at the BBNJ, which is about 50 pages, but it seems to have a lot of positive lessons for the process. Okay, we come at the end. I won't even try to summarize, but I think it's been a pretty rich discussion. I think it's given you some food for thought. And there's also that this is a conversation that we can continue. We certainly pursue some of these issues and look forward to continue the conversation. Please join me in thanking not only our speakers, but also the staff of the Global Health Center that has made this possible. Daniela Moric, Alessia Di Castro, Sara Lafontaine, and Moin Saripur.